Okay, the purpose for my research is helping people to live healthy, happy and vibrant lives. Now, people are challenged to do this when they're suffering from chronic conditions such as cardiovascular disease, type 2 diabetes and asthma. These conditions are related to overweight and obesity. Now, there's many factors that have contributed to the increase of overweight and obesity in recent decades. However, in 2014, the National Health and Medical Research Council identified that preventing excessive gestational weight gain is a key factor for preventing overweight and obesity. So when women gain too much weight during pregnancy, there's adverse outcomes for mother and child. For the mother, they're at an increased risk of gestational diabetes, hypertension and caesarean section. It also makes it very difficult for them to return to their pre-pregnancy weight. Therefore, they're at a greater risk of being overweight and obese later in life. For the child, they're also at risk of pregnancy complications and they're more likely to be overweight and obese later in life as well. Women who are overweight or obese at conception are most likely to gain in excess of current recommendations. Therefore, optimising weight status before pregnancy and during pregnancy is crucial for the prevention of overweight and obesity. Now, the best way to help women manage their weight for pregnancy currently remains elusive. Some of my preliminary research from a global sample has found that women still prefer to seek advice for weight management from people who they trust, like their doctors and their midwives for pregnancy. However, we also know that many doctors and midwives feel a little bit out of their depth when they're communicating weight management advice to women. This is because they don't want to offend women, and some are even a little bit unsure of what current recommendations are. So my research question is, can we help health professionals, such as doctors and midwives, support women to optimise their weight for a healthy pregnancy? Now, this isn't to put dietitians like me out of business, but it's to help health professionals help women to manage their own weight for a healthy pregnancy, to provide consistent and clear advice, to identify women who are most at risk, and then refer to the wider multidisciplinary team where appropriate. So I'd like to finish off by reading a referral that I had for my own private practice earlier in the year. It says, "Dear Ruth, thank you for seeing Nellie," that's not her real name, "age 36 years for opinion and management. She is getting married soon and would like to get her health into gear for pregnancy down the track." Now, I was really rapt when I received this referral because it will help her baby have the best start to life. And ultimately, this research is important because it will help children become healthy, happy and vibrant adults so that they can then go on and help their own children do the same. Thank you.